Hi, I'm Valerie Landell, President of Tri-State Care Partners. We are a network of Cincinnati's top healthcare providers, including your company. Things are always changing in healthcare, and the next several years are going to be very unusual. All providers will need to adapt in order to survive, but we don't want to survive, we want to excel. And our success will be defined by better outcomes for our patients and clients. That means meeting their needs on a broader basis than we have in the past, and you can help. When you're in the field, you see people with needs beyond your training and the services provided by your company. A famous poet once said, "It can take many ears to hear what our patients and families have to say." For example, when your patient's not fully mobile, you may see the need for grab bars or wheelchair ramps, or see the need for a nurse or home-delivered meals. Getting them the right help will help improve their chance of success and make your job easier and more rewarding. Tri-State Care Partners is the tool to getting help outside your field. We were established to bridge that gap to connect the top healthcare providers in Cincinnati and coordinate their efforts. We are a team. Our goal is to improve communication between key providers, reduce complications, and reduce hospitalizations. You can access Tri-State Care Partners with a single phone call. We set up this number specifically for you, the direct care providers. This is an internal number and it's confidential. Tri-State Care Partners will evaluate the situation and communicate with the patient and family and coordinate with you. That leaves you free to move on to your next patient or client. This video will give you a good picture of who we are and what we can do. We will also give you a brochure to help you keep the players in mind. If you have a question, call us. We'll talk it through. A call's not a commitment, and there's no cost for a call. So remember, Tri-State Care Partners is the place to call when you don't know where to turn. Here's an introduction of our partner organizations.
Hi, I'm Kristen Worthington with Home Helpers. As an integral part of Tri-State Care Partners, Home Helpers is the premier private pay, non-medical home care company in Greater Cincinnati and Northern Kentucky. At Home Helpers, we strive to make life easier for our clients by providing nurses' aides and caregivers to assist with activities of daily living, including light housekeeping, personal care, meal preparation, errand running, companionship, and much more. We have extremely high levels of customer satisfaction that we're very proud of, and has resulted in us winning Best of Home Care 3 years running based on customer satisfaction surveys. Our employees are carefully selected and strategically matched up with our clients to best meet client needs. So whether it's 1 time a week or 24/7 care, Home Helpers will be there. Home Helpers join Tri-State Care Partners because we feel strongly that collaborating with our high-quality partners will improve outcomes for our customers.
My name is Jerry McIntyre, Director of Modifications at People Working Cooperatively and Director of Whole Home. PWC provides home repairs, weatherization, and home modification services for low-income homeowners in the region. PWC extended its mission with the launch of Whole Home, a service to provide home modifications for persons regardless of income. Whole Home opened a showroom recently where families can see and experience some of the options available to them as they make changes in the home. As we grow older, our mobility needs change, and our home environments need to change to meet those needs. Sometimes it's as simple as the installation of a grab bar in the bathroom, or an access ramp into the home, or a major kitchen or bath remodel. We join Tri-State Care Partners because we want to see people live safely in their homes as long as they wish.
Hi, I'm Mark Reckman of Wood and Lamping. For the last 30 years, I've been practicing elder law. What is elder law? Well, it's a lousy name because it's not about the elderly. It's about the legal issues that arise from chronic illness, terminal illness, and long-term disabilities like mental illness. Let me give you an example. I met with a woman this morning whose husband was just placed in a nursing home. She's afraid she'll be wiped out by the $100,000 a year annual price tag. I was able to organize her finances in such a way that we should qualify him for Medicaid. We'll be able to save her house, we'll save some of her life savings, and will protect enough of her income to live for the rest of her life. I joined Tri-State Care Partners because it gives my clients an inside track to the best care in Cincinnati.
Hi, I am Wendy Knight, the General Manager with VITAS Innovative Hospice Care. Coping with life-limiting illness is very difficult for most people. As the nation's leading provider of end-of-life care since 1978, VITAS Innovative Hospice Care provides patients and their families with the high-quality, compassionate care that they need, including managing their pain and symptoms and providing emotional and spiritual support. The VITAS interdisciplinary teams of primary care and hospice physicians, nurses, home health aides, social workers, spiritual care counselors, bereavement counselors, and other specialists provide care wherever patients call home. When a patient has an advanced life-limiting illness, the staff members and volunteers at VITAS Innovative Hospice Care are ready to offer options to help ensure comfort, dignity, and peace of mind. VITAS joined Tri-State Care Partners to collaborate with the leading healthcare organizations in Cincinnati.
My name is Steve Smokler, and I'm Chief Operating Officer for Wesley Community Services. And Wesley Community Services assists seniors so that they can remain in their home for as long as possible. And we do that through a variety of services. And one of the main ones that we do is we provide Meals on Wheels to seniors in their homes. And we've developed a specialty where we provide diabetic home-delivered meals to individuals with severe diabetes so that they can control their disease. We're a participant in Tri-State Care Partners because we feel that it offers a broad base of services to any one of our clients so that all they would have to do is make one telephone call and receive the services that would support them staying in their home as long as possible.
Hello, my name's Bernie Tarbin, and as the General Manager over Home Infusion, I just wanted to thank you for taking the time to learn about our services. Our pharmacy has a high-tech nursing component that enables us to provide comprehensive care to patients throughout the entire course of therapy. The medications are mixed under stringent conditions in our pharmacy as ordered by the physician and are delivered to the home where the patient and/or caregiver administers the medication. This is done after thorough training has been provided by our infusion nurse. In closing, we joined Tri-State Care Partners because we feel very fortunate to be able to work with other home care providers such as yourself and view our services as an extension of your care.
I'm Nancy Archdeacon. I'm a respiratory therapist and the managing partner at Pro2 Respiratory Services. Pro2 is a durable medical equipment company specializing in the care of the patient with any type of respiratory disease, such as COPD or sleep apnea. When people are discharged from a hospital or leave their physician office needing oxygen or other respiratory equipment, from aerosol therapy to mechanical ventilation, Pro2 will provide the equipment in their home to allow them to receive the therapy they need. I think what sets Pro2 apart from our competitors is the fact that we have highly experienced respiratory clinicians on our staff who can talk directly with physicians and other clinicians to make sure that the patient has the right equipment and the proper education to use the equipment effectively. Joining forces as Tri-State Care Partners makes perfect sense in this challenging and changing healthcare environment. As members of this collaborative, we are better able to be leaders in the type of comprehensive, coordinated care that provides for the total needs of patients in their homes, which is where they want to be.
Hi, I'm Valerie Landell, President and CEO of the Visiting Nurse Association. We provide home health services in the individual's homes. Our services include nursing, physical therapy, occupational therapy, and other services to treat chronic and acute illnesses such as diabetes, heart failure, wounds, or after surgery care. Sometimes you may find patients who've had balance issues or a general change of conditions, and those patients we can help you take care of. We joined Tri-State Care Partners for better patient care, better coordination, and better satisfaction. So remember, Tri-State Care Partners is the place to call when you don't know where to turn.